Yeah. And how is it? I think I haven't looked into this in 10 years after my PhD. So do we know more from last 10 years? Why do we lose muscle mass and strength? Because I'm thinking like I think it is that we lose more muscle mass in a distant muscles. So for example, calves, we lose more muscle mass than in thighs because the nerve is longer. So if I remember right, I think there's a bigger chance of a motor neuron dying when it's long nerve, which kind of doesn't support the inactivity thing that you are not just using, because there seems to be also a kind of connection between the nerve length. Do we know? I might remember wrong, so feel free to correct me if I'm talking nonsense.
So what like I was saying, what we know at the moment is that it is very, very much a multifactorial disease. But the prime, let's say, initial reason for people losing that muscle is inactivity. And it might sound like an oversimplification, but what we see is that as people become older, and I think it's quite, like, if you think about it, it does make quite a bit of sense. After university, a lot of people start becoming less active. They get into jobs, they spend a lot more time sitting down. As a society, we have a lot less physically active jobs. And then if you get into, let's say, the retirement age area around 60, people stop working altogether. And unless they're quite dedicated, their activity levels drop considerably. And it's around that age when we see massive drops in muscle mass and strength. So inactivity is the main driver, but there's a number of other factors involved as well. And one of those primary factors is something that we call anabolic resistance. And it's a bit of an umbrella term that is used in relation to the body's inability to react sufficiently to what we would call anabolic stimuli. And our two primary anabolic stimuli are exercise, particularly resistance exercise, but exercise and protein. So what it means is that we can give the body the same dose, for want of a better word, of exercise or protein, but it won't react as strongly to it and build muscle as efficiently as it would as a young person. So to give an example, I think the best example of anabolic resistance comes with protein feedings. And if we look at a lot of the research, if you give a young person, when I say a young person, somebody around their 20s, if you give them a dose of a high quality protein like whey protein, if you give them 20 grams of that whey protein, you can almost maximally stimulate muscle protein synthesis, which is the process that we use for building muscle and for muscle repair. If you give an older person that 20-gram dose of whey protein, you do not see as much a response to that. And we've actually seen that you might need to give them twice that amount, so maybe 40 grams or even more protein, just to get the same amount of a response as a younger person. So you got 20 grams over here, but you got 40 grams for this older person. And that's a lot of protein. And if you look at, let's say, cross-sectional data on diet in the UK, at least, you see that older people are very, very rarely getting that much protein in a single meal. In fact, protein is quite low in the macronutrient intake in older adults especially. But then there's other factors that feed into that. We see an increase in inflammation in older people. Part of that comes from having higher levels of body fat. We see decreases in the ability to actually digest food and to digest protein, which can have an effect on them as well. And then we also see just the effects of we see a cyclical effect, which I like to call the sarcopenic obese cycle, is whereby older people become inactive, they lose muscle mass, that makes it harder for them to move. They tend to gain a little bit of body fat because they're not moving as much. That little bit of body fat makes them a little bit heavier, which makes movement even harder, which reduces movement and then reduces muscle. And we have this horrible cycle going around, and it's very, very hard for them to break out of that. So yeah, there's a number of factors involved.
And you said about the anabolic resistance. Has it been linked to the hormonal milieu of the person, or what's driving it?
It can absolutely be related to that as well. So we know that in older men, for example, we see a small decline in testosterone over the course of their life. So basically in some men from their late 20s onwards, we see that decline in testosterone. In women, we see around the age of menopause massive drops in estrogen, and we know that estrogen in women carries out many of the same functions as testosterone in men, so it has quite an anabolic function. and we see that decline. But it's kind of harder in women to be sure if that's playing a major role, because we also know that around time of menopause, usually for a lot of women, tends to be a period of decline in physical activity as well. So we do have this drop in an anabolic hormone in women, but it's very, very hard to say how much of the effect of sarcopenia is generated just from that one cause.
And is the drop the same basically for active and inactive people? So do we see a difference in the anabolic resistance between people who are active and who are not?
Yeah, so in people who remain active throughout their life, we do not see a considerable drop or a considerable increase in anabolic resistance. People who seem to maintain activity throughout their life seem to be able to respond to exercise and to dietary protein quite effectively, at least much better than individuals who become sedentary. And unfortunately, in today's population, we have a large proportion of the population that is sedentary.
Yeah. And what do you think is the mechanism? Why do the active people are able to avoid the anabolic resistance? Is it the hormonal related, or do we know anything why is it?
Again, it's something that we're not 100% sure of. So the whole driving, let's say the drivers of anabolic resistance, we do know that the mTOR pathway, and just for anyone who might not be familiar, we know mTOR pathway is a metabolic pathway associated with muscle protein synthesis within muscle. Some research has come out indicating that that mTOR pathway becomes less sensitive as we get older. And we believe that in some individuals that are less active, the signaling pathway in mTOR becomes less sensitive through inactivity. But because the mTOR pathway and all of the associated pathways with muscle protein synthesis are so complicated, it's very, very hard to point or pinpoint where the original cause of this is.
Yeah, that's interesting. Do you have anything else to add into this kind of part of the topic we are discussing?
Well, I suppose like just from that, like I always like to kind of say to people that kind of focus on how important muscle is. And while we are talking about like, being strong and we have originally been talking about cardiovascular disease, muscle mass and muscle strength are associated with so many beneficial outcomes. We know that people with lower levels of muscle mass tend to have, like I said, a higher risk of falls and fractures. They've got a higher risk of osteoporosis. They tend to have a higher risk of a number of other conditions, such as we see a higher risk of chronic kidney disease, a higher risk of non-alcoholic fatty liver disease, higher risk of cancers. And then we also see in people who have lower muscle mass a lower quality of life from a number of points. But that can also be related to poor cognitive health, which we see in lower muscle mass. So people their brains don't work as efficiently when their muscle mass is not as well maintained. And we also see higher levels of depression. And that seems like a bit funny, but if you think about it, if somebody has become very, very inactive and they find it very, very difficult to get out of their home and to go outside and see their friends, that's going to have a major impact on how they feel about themselves. If they lose independence and they're not able to socialize as much as possible, you can understand how that might have an effect on somebody's depression risk as well. So yeah, like I would say muscle mass it's a key factor that we need to maintain as we age, and it should be something that we should be aiming to work on from as young an age as possible, because what I like to think of is if you think of muscle mass as a buffer against age-related decline, the higher that you can build that buffer as from a young age, the slower, well, your decline will be the same speed, but it'll take you a longer time to get to a point where that's going to have a major negative impact on your health. So build muscle when you're young and try and maintain it as much as you get older.
Yeah, that makes sense. And I think it was very interesting when you said that people, when they stop studying, they start being less active, but then when they retire, they don't need to do that. Is there any studies showing, because the loss of strength is quite steep in the later part of life, I think after 70 or something? Is there any studies showing that it would be related to retirement and then being less active, using muscles less, or do we know anything on that? Is it just speculation?
So unfortunately, there's nothing that can like directly relate it to retirement. But I think if we look at the time course of those changes in muscle mass, and what you've said there is spot on. We see that muscle mass declines gradually, but from our let's say our late 30s onwards, it declines gradually. But once we hit the 50s and 60s, that decline becomes much more significant. And actually, the decline in strength becomes even more significant over time. And it is around that, let's say, late 50s, early 60s period when traditionally a lot of people would be retiring. And we can only associate and speculate at the moment that it's due to the fact that people just become a lot less active.
Yeah, of course, you could compare some people who still keep doing strength training, and you could see probably
Absolutely.
the difference. Yeah, would be interesting study.
And that is a good point, because we do have a few studies that look at what we call lifelong active individuals. So people who, for example, maintain some form of a sport, usually masters athletes. And we do see that in endurance masters athletes and in strength sports masters athletes, so people who do weightlifting, for example, we see that obviously the weightlifters maintain the most muscle mass, but endurance athletes also maintain a fantastic level of muscle mass as well. The weightlifters maintain more strength. But if you compare them to the general sedentary population, there's a major difference between muscle mass and muscle function as well. So those individuals who aren't exercising just do not have anything near the levels of muscle and strength that the lifelong athletes have.
Yeah. And what would be then the strategies based on all this? How to increase muscle mass, how to increase strength? Is it even important to increase muscle mass, or is it enough to increase strength from training, nutrition perspective?
So luckily, muscle remains a relatively plastic tissue even into advanced age. And we have a number of studies that show that resistance exercise programs, so particularly progressive resistance exercise, and by that I just mean lifting weights, or in some cases it can be easier versions like using resistance bands to do exercise, do result in increases in both muscle mass and strength in older adults. What we see is that strength seems to improve much more quickly than muscle mass itself. And that's probably due to improvements in neural control of muscle motor units initially. But those increases in muscle size do come as well. So these programs tend to focus on, let's say, full body routines where people are focusing on progressive overload. So basically, people need to be pushing themselves. It's not just kind of a matter of just going and lift a few weights, although doing anything is better than nothing, but having a guided program where people can be trained into how to progress their lifting and their strength over time. So using different weights, machines, and adding more weight, so they're challenging their muscles constantly over time. And so we see that those resistance exercise programs work. We also see that when you add in some form of protein supplementation into individuals who have lower protein diets, so adding protein on top of the resistance exercise seems to potentiate that effect, and you get an even greater increase in muscle mass over time as well.
Yeah, so pretty classic. You push harder and you eat better. That should work.